Welcome to the press briefing. With us today are Dr. Chuang Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. Dr. Chuang would first brief us on the cases. Good afternoon. Yesterday, we had 5,876 cases who tested positive through PCR tests. For those who tested positive through RAT, there were 8,273 cases. Altogether, there were 14,149 positive cases. The lower was slightly lower than the day before. Altogether, from PCR and RAT tests, there were 1,035,000 cases, including 675,925 cases who tested positive through PCR, 355,607 cases who tested positive through RAT. Of the 5,876 cases from PCR, 1,012 cases were detected by the HA, 903 were detected through the CHP's laboratories. Another 3,961 cases were found through private laboratories. The CHP would carry out analysis on the variant strains of the cases. Today, 1,628 cases were analyzed, including cases that tested positive through RAT, but which cases were also sent for PCR tests. Of these cases, there were no cases involving the L452R strain. 1,612 cases did not carry the L452R. In other words, they were allegedly Omicron cases. 60 cases were still pending, or the viral load was too low. Of the cases today, 4 were imported, of which 3 arrived in Hong Kong via 6702 on March 18. They arrived from Thailand or Mauritius. Another case took flight TL 980 from Singapore, who arrived on March the 19th. In terms of the relevant death cases, 246 deaths were reported by the HA, of which 205 were deaths on March the 19th. Another 41 were from earlier cases. 5,656 cases were reported by the HA. Altogether, 27 cases were reported from outside the HA. Altogether, there were 5,683 cases. These cases included 2,228 males, 3,455 males aged 11 months to 112 years old. As with the past, about 60% were residents from residential care homes and 90% were unvaccinated. In terms of the mortality rates, it currently stands at 0.55%. For those who received 2 shots, the mortality is about 0.1%. Those who were not fully vaccinated, the mortality is 1.37%. The difference is 14 times. We read some media reports on the vaccination status for those who contracted COVID-19. The reports were somewhat misleading, so I'd like to clarify the matter. So it's about the nominator and denominator. 80% received the Sinovac vaccine and 20% received the community jab. So this is comparable to the vaccination status of those above the age of 80. If we consider the entire population, the mortality among those who received 2 shots was 0.09%. Those who received 1 shot of either vaccine mortality is 0.7%. Those who received 2 shots, mortality was 2.58%. So there is a huge difference. In other words, even if you receive 1 jab, you would be afforded much better protection. For those above the age of 80, they accounted for the majority of deaths. Of the 5,000 odd cases, 3,837 people were above the age of 80, of which 74% or 2,837 cases were unvaccinated. They did not receive any shots. So in terms of the comparison between the vaccinated and unvaccinated, we could see that vaccination certainly helped. The majority of deaths were unvaccinated persons. 26% of the deaths were vaccinated. For those above the age of 80, if they had received 1 shot, well, for those who were unvaccinated, mortality was 15%. For those who received 1 shot, mortality was 5.59%. In other words, even after they received 1 shot, whichever vaccine it was, mortality would come down by 2.7 times. For those who received 2 shots, mortality rate was 2.62%. So there was a reduction of 5.7 times. So those who received 1 or 2 shots would see much lower mortality. If we compare those who received 1 shot of Comirnaty and 1 shot of Sinovac, for those who received 1 shot of Sinovac, mortality was 5.83%. Those who received 1 shot of Comirnaty, mortality was 3.44%. So we could see that the choice of vaccine did not make much of a difference, but the vaccinated would have much greater protection. Of course, those who received 2 shots would enjoy even better protection. In terms of residential care homes for the elderly, we received 2 reports yesterday involving RCHEs involving 15 residents and 2 staff members. In recent days, we saw a slight decline in the RCHE outbreaks. In the past 14 days, 190 homes, including 168 RCHDs and 122 RCHEs, a total of 4,283 residents, or 4.6% of the total, were involved, and 1,232 or 2.8% of the staff members were infected. That's all for my report. Dr. Lau will now brief us on the situation at the HA.
We have 10,742 patients who are in the North Rental Hospital Infection Control Center, HA Infectious Disease Center, AWECTF, for treatment. 35 patients are in critical condition, 85 in serious condition right now at the ICUs. And in critical condition, the number stands at 115 as at 00 hours. Over the past 24 hours, 205 COVID-positive patients passed away, 126 males and 79 females, ranging in age between 44 and 104. Of those who passed away, 99 were from the homes. Of those who passed away, 129 didn't have any vaccination, or 62%. 44 had 1 shot. For those who are unvaccinated and those who have 1 shot, the total number stands at 173 or 84%. In other words, 84% of the patients either didn't have any vaccination or were not fully vaccinated. 2 shots, 31, and 3 shots, 1. Those about 65, 194 or 94%. I'd like to mention 4 patients who were relatively younger. A 44-year-old patient at birth, he suffered from oxygen deprivation in the brain, and he had a mobility problem. He also had a cirrhosis problem. So this was a chronically ill patient, and an 84-year-old patient. This person had congenital problem with a mobility problem, and there was also diabetes and thyroid problems, chronically ill. A 52-year-old patient had the immunity disorder affecting the lungs and the kidneys. The patient had to have hemodialysis. A 58-year-old patient suffered from lung cancer that has metastasized to the brain and to the bone, and this patient was chronically ill. Because of time lag, we have submitted the numbers between 10th of March and 18th of March. There were 41 who passed away, 22 males, 19 females, ranging in age between 45 and 98. Over the past year, we had 884 patients who have recovered and been discharged. Upon screening upon the admission for screening, there were 7 who were picked up with positive COVID positive, and there are 10 close contacts. 19,550 X-ray staff have been infected, and 12,878 have already resumed their posts. For the Qingyi Community Isolation Center, in the light of the latest COVID development, starting from today, the medical post at the Qingyi CTF will be handed over to a private medical organization, and there will be medical staff who will be posted there to render support for the patients. The original staff there would be redeployed to other facilities to continue with the anti-COVID effort. We're grateful to this private medical organization for lending a helping hand at this critical time to help those who are isolating there. And we're also grateful to the SB for helping the medical organization to provide all the medical support. The Qingyi CIF started in March, and the hospital authority has been posting staff there to render support to the isolatees, and also to address all the medically related inquiries. And where necessary, we also provide medical support. The X-ray team will tie in with the government's arrangement and join hands with the private organizations and provide medical support to various venues. I now throw the floor open for questions. Please identify the media organization you represent. Gentleman here. TVB. A question about the vaccine pass. It was announced that the third jab arrangement will be brought forward. Now, for those who are not fully vaccinated but have contracted the virus but recovered and have not made the declaration, do they have to have an additional jab, or do they have to make the declaration? What advice do you have for them? I think it has been said in the press release that for the recovered patients, they can or if they have evidence to prove that they have been infected. Now, if they just say that they suspected of having infected, it will be difficult. But if they do have any evidence to prove that they have been infected, and the doctors believe in him, then the medical certificate can be issued. Basically, many people are not aware of their infection because they can be asymptomatic, so they can rest assured that they can go get the jab. They don't have to be worried about any undesirable consequences. But if you have been infected, then you don't have to go get the jab within 3 months, because it would be better for the immunity if you leave it for 3 months. But as I said, many people are not simply aware of their infection. If they go to get vaccinated, it doesn't present any problem at all. The one in orange, please. Phoenix TV, I heard that the positive number seems to be on a downward trend. This morning at the press conference, we heard that from the sewage surveillance, there is a likelihood of a rebound. Does it mean that going forward, the number is going to go back up? There's going to be an upswing. How do you envisage the issue going forward? You can take the question in Cantonese. I don't think we can look at the number of days and say that there is going to be a rebound. Now, if there is some more mobility, more people going out and about, if we relax the social distancing, or if we don't observe the personal hygiene, then there is a likelihood of a rebound. There are so many cases still in the community. We have confirmed more than 1 million cases in the community out there. There are still many cases that have not been picked up. If there are frequent activities in the community, there is a likelihood of a rebound. But for the time being, we don't know how the situation is going to pan out. Now TV. Now for the vaccine pass, the third jab has been brought forward. Why do you take the decision to bring this forward? Now you said that the recovered patients, they can show the certificate for them to gain entrance to various premises. Now we have the isolation order, we have the SMS. Would this present any difficulties to the scheduled premises? Will the food establishments be in a position to tell whether the proof is legitimate, and would they be banning people from entering? And for the oral antiviral pill, it is said that the clinical protocol will be revised. What result can you tell us? And also, when the mainland medics are coming to Hong Kong, there will be more beds to be opened at the AWE. How soon will this happen, and how many more are there going to be? I think at the present moment, we very much hope that for people to gain entrance to the premises, they can present their proof to the responsible person for them to gain entrance. I understand that the government is preparing some electronic versions for the proof to be identified, proof of recovery, and so on. As to the 2 oral antiviral drugs, the experts have had a meeting, and they are making the final revision. There will be areas like the age and so on that will be revised. And all these clinical guidelines that will be communicated to the front line will let them know about these guidelines when they see the patients, and they will be looking at the different factors like the ones that I mentioned, the symptoms and also the physical condition, and then prescribe the right medicine.
亞博館嘅我哋而家暫時內地援港。
For Asia World Expo, the mainland medical support team had started work in halls 8, 9, 10, and 11, and we have activated new beds every day. we can activate up to 1,000 beds in total. Our original plan was to accommodate younger patients and those who could take care of themselves, but we would ensure that all needy patients would receive the care here, and we would continue to reinforce the number of beds. Next question, please. I'm from cable TV. Some reports indicated that for 2 straight days, some members of the public or residents of care homes suffered sudden deaths, and including Chun King Wai today. Were they above the age of 80, and why did their conditions worsen so quickly? Was there a lack of support for these care homes? Under the vaccine pass, the requirement to demand 3 doses would be brought forward. Is there a need to procure more vaccines or to open extra vaccination centers to meet the demand? Professor Yuen Kok Yung suggested the elderly to receive the community jab, and he said that the Sinovac vaccine cannot protect one against Omicron. What is your view on that? The government will certainly monitor the needs of those who are to be vaccinated and make appropriate arrangements. If there's a great demand for vaccination, new centers could be open, and they would also ensure an abundant supply of vaccines. For the Sinovac and community vaccines, they could both help lower the mortality rates, even for those who only receive 1 shot. I have no information on the patients you mentioned, but I'd like to call the public's attention to certain matters. Currently, we provide different forms of support to patients in the community. If you had tested positive through an RAT or PCR test, you must declare your case with the Department of Health. So if you declare yourself positive, then your information would be registered with us, and we can provide appropriate services for you. Once we receive a declaration, if you are an infected person in the community or an isolation center, you would receive an SMS which contains a link. You must register your particulars, health conditions, medical history after you click on the link. For high-risk individuals such as those above the age of 70, under the age of 5, or pregnant women, or if your immunity is compromised, our team from the Patient Support Call Center would make calls, and we would issue timely reminders for those who experience symptoms. If you or your family contracted COVID, or if you work in elderly care homes, for those who suffer fever for more than 2 days, or those who suffer chest pain, if any of these symptoms are detected, one should go to the A&E ward immediately. Some studies show that patients carrying these symptoms could see their conditions deteriorate rapidly, and ultimately that might lead to death. That is why we are providing a hotline to the public. Those who experience issues can call the hotline to learn more about their conditions. The hotline is 1-833-6115. If we feel that support from doctors are needed, we could answer their questions by video conferencing, and we might also recommend an appointment at a designated clinic, especially for the risky individuals, the elderly. We are providing a care booking line. So the key is to report your positive result, or else no one would know that you had contracted COVID. And after you receive the link, remember to click on the link and furnish your particulars. If you do not know how to fill in the information, you can seek help from your family. So I call upon everyone to take care of sick family members, especially the elderly. For people who live alone, they could seek help from neighbors or social workers. So we call upon everyone to offer support in this hour of need. Through these services, we hope to support those who are waiting to be transferred to isolation so that they could receive proper treatment. Next question, please. We will take a question in English.
From SCMP News. I have a few questions. This morning, the CE said that people who were infected with COVID-19 since December 31st will be exempted from the restriction testing declarations. So may I ask, will this exemption apply to compulsory testing notices as well, in which the CE has announced would be starting again in the near future? My second question is regarding the vaccine data amongst the deaths during the fifth wave. Since the government had all this data on hand, why wasn't it announced earlier at a press conference for transparency purposes, and instead they have to come and clarify it after local media have published the data? My last question is on the Tsingy CIF. How many private staff members will be deployed there? And will there be any logistical issues or differences in care when it comes to taking over, the CIF? Thank you.
I understand the restriction testing declaration is the exemption for those who had recovered from COVID-19 since 31st of December is because that usually a patient who recover from the illness, they will not get reinfection in the next 3 months. And also if you test on them, you perform PCR test on them, some of them, they may still carry fragments of the virus and can be tested positive. So there's no need to do that. And I do not have further details on the compulsory testing arrangement. I understand this is a major operation that needs coordination between various government departments, and it will be the details will be announced once it's ready. We have published our data on our website, including those number of deaths and also those vaccinated and non-vaccinated, the differences. And also we have been reporting the differences between the case fatality rates among those fully vaccinated and not fully vaccinated for all these press conferences.
Concerning the Tsingy isolation facilities, currently there are doctors as well as nurses on site to provide medical support to the people who are living in the isolation facilities. There are also some overnight on-site nurses who can also provide services to the citizens who are living in there. We have a transitional period. That means our HA staff will work with the the medical group staff for a few days in order to teach them how to carry out the job. But it's not difficult because they are doctors and they are nurses. they have full knowledge about how to take care of the patients in the isolation facilities, because most of the citizens who are living in the isolation facilities have no or very mild symptoms.
下一題，呢邊間條衫。
A gentleman in stripe top. HKO1 about the positive numbers. 2 days in a row, the number has dipped below 20,000. One day lower than the other is going to be pointing to a downward trend. Second, about the antiviral pills. They've become available in Hong Kong for some time, but it seems that there is no decrease in number of mortality. Why is it that there are so many fatal cases? It's because they have not been prescribed these new drugs in time. Also, RTD. We can see that in a block there can be 700, 800 flats. A quarter of them may not answer the door, but subsequently you find that there are dozens of people who fail to be tested. Is it because you're not imposing any fine and people can't be bothered about the testing? And for these RTD, from the press release, we learned that the cases identified as preliminary positive. Now, we do have the RAT kits, and the positive results using RAT can be recognized. Under what circumstances would you identify these cases as preliminary positive? Are there actually positive cases? Right, the decline in numbers can be attributed to certain factors, and maybe we have gone past the peak in the community. There may be a significant number of people who have already got infected, and there are a significant number of people who have the immunity via infection or injection. And also the social distancing measures. All these would be at play to affect the situation. We hope that there is going to be a decline, but we still have to maintain our vigilance. We have a very high base. There are many infected people in the community out there. If the social activities are becoming more frequent, there is a likelihood that there's going to be a resurgence. I understand that for RTD operations, when they cannot get in touch with people, they will follow up and there will be penalty to be imposed. Preliminary positive cases are actually positive confirmed cases. For the 2 antiviral pills we have prescribed quite a lot in the recent past. For the MSD molnupiravir, we have prescribed 9,300 to 9,400 patients. For the Pfizer Paxlovid, we have prescribed 1,600 or so. Now we use it in the A&E wards, in the designated clinics. We prescribe them at the old folks' homes, at the GPOC or the hospital wards for sure. Even for the CIFs, we also are prescribing these antivirals. So we are prescribing these on a very extensive basis. In some cases, the patients would have to turn up for medical attention because they feel unwell, and they can be prescribed these. Now, for the high-risk people or elderly people, people with immunocompromised conditions or chronically ill patients. Now, for these people, if they feel unwell, they should make an appointment to seek medical attention as soon as possible, either at the designated clinics or at the A&E department. One should not leave it too late. If one feels unwell, one should get medical attention as soon as possible, and the drugs can be prescribed. Speaker not coming through. For the fatal cases, there can be many reasons. There are some senior citizens who are in the elderly homes, the conditions might deteriorate. These drugs are prescribed for the mild and medium, those with mild and medium symptoms. We have different drugs for patients in different conditions. The idea is to ensure that they recover as soon as possible. Gentleman over here, Ming Pao Daily. Dr. Chuang, you mentioned a moment ago that in terms of BioNTech, one shot 3.44, Sinovac one shot 5.83%. Are you talking about those above the age of 80 or what? Now, with this mortality rate, can you tell us in the fifth wave, in terms of infected cases and in terms of death cases, what is the ratio between Sinovac and BioNTech? And if you don't have the numbers with you, how soon do you think you're going to have the figures made available? Also, there are some colleagues who mentioned that for Sinovac and BioNTech, there is a bit of a gap in terms of the antibody protection, and it is advised to get BioNTech. Are you going to be arranging for more elderly citizens to get BioNTech? And vaccine pass, the timetable is for people to have 3 jabs. And according to the new guidelines of BioNTech, it should be 2 shots for those who were vaccinated with BioNTech. If someone is vaccinated with 2 jabs of BioNTech, would they be qualified? Would they be eligible to enter the premises? Now, AWE, Dr. Lau, you mentioned that every single day the number of beds is increasing. How many beds have you increased? And what is your target? Are you going to be having other measures? And how will the mainland medics be of assistance in this regard? I mentioned 3.44 death rate. That's for over 80 with 1 shot. For those with 1 shot of BioNTech, it's 3.44. Those with Sinovac is 5.83%. Now, in terms of the vaccine pass, it doesn't make any distinction between Sinovac or BioNTech, and it specifies 3 shots. Speaker not speaking through. I don't have this number with me for the time being. I think very simply, if we have mainland experts coming to Hong Kong, we'll have more doctors and more nurses. And of course, there are more carers assisting us. Then we would have more strength to look after the patients. There will be qualitative improvement for sure. And with additional manpower, we can cover more patients. So qualitatively, there will be an improvement. As to how much I can quantify at the moment, every day, if there is a need, there would be more manpower to be deployed from the clusters. As to whether the number will or has been increased, indeed, some patients have been discharged, and there are patients coming in, there are patients going out. I don't have the number with me now, but I can assure you that with more mainland medics in Hong Kong, the patients at AWE can be looked after by more manpower. As to whether there will be increase in the manpower, it all depends on the COVID situation. When it's true, we will deploy the right number of people, like AWE, to look after the patients. We do have the tiered arrangement. The most severe cases would remain in the ICU or the hospitals.
Next question, please. I'm from AM 730. In terms of the community isolation facilities, in terms of the discharge requirements, are patients required to produce negative results on day 6 and 7, or would that no longer be needed? In the Qingyi facility, the government said a private operator would be involved, and how many people from them would be deployed, and how much of your manpower would be freed up, and are other facilities in the pipeline as well? You said those who recovered would not be subject to testing, and you said they are not at high risk. Can you tell us in clear terms when they would no longer be infectious after they recover, and would the relevant measures be reinforced for those who recovered normally about 3 months or 90 days after, well, within 3 months of recovery, they are unlikely to be infected again, and after they recover, they are unlikely to be infectious. At the Qingyi facility, there would be 1 doctor and 5 nurses on duty every day. Some would work on site, some would work off site. All I know is that there would be doctors and nurses every day, including at night, so there would be medical staff around the clock. We had doctors and nurses here before as well. We had 1 doctor plus a few nurses every day. And different isolation facilities would provide medical support services, so the manpower would be deployed as necessary. The government would work with private healthcare institutions, including private medical groups and private hospitals, and we would negotiate the provision of healthcare services at different facilities so that DHA staff could be deployed at public hospitals or the Hong Kong Infectious Control Center. The speaker is not coming through the microphone. For those who recovered, they are likely to be infectious after they recover, but for the sake of themselves and those around them, they are still urged to maintain hygiene. Next question, please. I'm from News. Previously, owing to a lack of manpower in Guangxi, 131 support team members arrived in Hong Kong to provide help. After a 3-day training, they would be deployed at the front line. Can you give us more details on their actual work arrangements? Some interviewees said that the hotline for the makeshift hospital is extremely busy and they could not connect. Some legislators recommended a reinforcement of manpower. Does the government have any plans? And due to the backlog of bodies, the DH has extended the body identification service to Saturdays and Sundays. Would forensic doctors who had retired be hired again to solve the problem? For the mainland medical support team, they had moved in already and started caring for patients. They did not receive specific training since they had experience taking care of patients on the mainland. The speaker is not coming through. I do not understand what you were referring to. The mainland medical support team comprised mainly of doctors and nurses. They would take care of needy patients in halls 8 to 11 of Asia World Expo, and they started work already. You talked about a hotline. I'm not sure which hotline you were referring to. Some hotlines would connect to the Security Bureau. Apart from the hotline, we have the isolation care monitoring system. It is designed for patients in the community who are being isolated, as well as those in the isolation facilities. Patients would receive an SMS message, and upon clicking on the link, they can declare certain particulars, tests, results, health conditions, etc. So that is one way to communicate their conditions with our healthcare staff. But I do see room for improvement. From 6 p.m. on March the 15th to noon March the 17th, some 113,000 SMS messages were sent, but we only received some 44,000 registrations. So I'd like to remind everyone to declare their particulars upon receiving the SMS. The website carries a lot of information on what one can do after they test positive, points to note, etc. And reminders would be issued on conducting RATs. In terms of the handling of bodies, since early March, the Department of Health has engaged retired staff and staff from other grades in order to speed up the identification of bodies and autopsy. So through internal deployment, we would speed up the public inquiries related to the public mortuaries. Final question for the day. I'm from In Media. For the declaration system, for those who tested positive using RAT, would an SMS be issued automatically upon declaration? Some people told us that after they made the declaration for a week, they never received an SMS, and no answers were received upon making telephone and email inquiries. So can you shed some light on the situation? If no SMS was received after one has recovered, what can they do? Professor Yun Kwok Yung said we should make a distinguishment between those who died with COVID and those who died of COVID. Would the authorities make relevant investigations and disclose the results? We are aware that some people did not receive SMS messages after making a declaration through the system. So for those who run into such situations, we reissued SMS messages. Sometimes if you switch off your microphone, switch off your mobile phones for some time, you might need to switch it back on and wait a while before you receive the SMS. So if SMS messages were blocked due to certain settings, you would need to make adjustments. For the 5,600 odd COVID patients who passed away, not all died of COVID. Like I said before, some fell from height, some suffered a stroke, but they had no symptoms at all when they were admitted to hospital. You could imagine that it would take time to analyze the 5,000 odd deaths. For patients who were old or had chronic illnesses, it could be difficult to identify their actual cause of death. Some HA experts have analyzed certain cases, especially those that involved younger patients, For the younger patients, it might be easier to determine whether they died of COVID or with COVID. So hopefully meaningful conclusions could be drawn, and once we have results, they would be shared. This is the end of the press briefing. Thank you.